This is the Clinical Documentation Translator program. It is a prototype that I built to help physicians improve their clinical documentation, and also for CDI specialists to be able to review discharge summaries and highlight areas of strengths and weaknesses. We begin by clicking on the demo button, which inserts a discharge summary. Notice here that the word sepsis is automatically highlighted. One of the features of this program is that it translates clinical terminology, like the sentence here. This patient with chronic renal insufficiency presented with mild confusion got translated into this patient with chronic kidney failure of mild to moderate severity. Simply because billing or coding language does not allow for the word insufficiency, it automatically substitutes in mild to moderate severity. The other area where it catches the word urosepsis, because that is not a ICD-10 or ICD-10 recognized clinical term. Therefore, when the program finds the word urosepsis, that gets translated into there may be a systemic inflammatory response, SIRS, due to, and then the physician would insert the organism responsible here, and it also states, I suspect sepsis due to urinary tract infection. The other feature of this program is it parses out all the words found in the document over here on the right. And let's say we want to look up the word failure. We click on this and it finds it there. If we want to find the word GERD or GERD, you notice it finds it down here. However, you'll see that these three areas are still highlighted. By clicking on this button down in this area, it would reset the text and simply focus in on the word GERD, and you notice this area is no longer highlighted with blue or green. The other thing you can do here also is to look up something on the internet. You simply click on one of the words, for example, tachycardic. You double click here, and that would, let's see, double click there. Yes, there it goes. It launches a browser to Google and automatically looks for tachycardic associated with ICD-10 in the Google browser, or in the Internet Explorer browser using the Google website. Now, getting back to the translator program, the final feature I would like to run through very quickly is this button right here that illustrates CDI, or Clinical Documentation Improvement Best Practices. When the user clicks on here, you'll notice it takes you through a series of teaching statements. For example, it is important for revenue management that we capture and document accurate clinical information. The lack of complete documentation will alter the morbidity and mortality data. The lack of complete documentation will alter the CMI, or case mix index. Low CMI scores and high mortality scores influence physician and hospital profiles. And finally, a few other ones. For example, physicians should describe the importance of laboratories, radiology findings, and pathology reports. And it is wise to use words like due to and related to for inpatient documentation. Also, in inpatient documentation, you can use words like probable, possible, suspected, acute, and chronic. And it is also wise to paint a better picture of the patient's severity of illness and risk of mortality. And that is what the program is about.